I see Ronnie with her wine. Oh, Ronnie. Derek. Okay, so I have this nice little flyer here, and it's very, very true. It says it's happening in the Blue Wave Lounge, and it is right now. And thank you very much to Beth Sufian and her firm Sufian and Casamano LLP. They have hosted this very nice reception, and Beth is going to come up and talk to us about the changes occurring in Social Security for those with CF. We couldn't be more delighted. She's been an avid supporter of CFRI and those in the CF community, and I would like you all to help me welcome her tonight to give us a nice chat.
Thank you. Don't worry, it's going to be short, because I know some people are very tired. But I did want to thank Sue for agreeing to have me speak tonight. It was the new rules for Social Security came out a very short while ago, and I called to say, is there any way that you could squeeze me in so I could let people know about the changes? And I think only CFRI would say, of course, without hesitation. If it means bringing new information to families and people with CF and their healthcare workers, we are interested in doing it. So I think it's just exceptional that they were so quick to say, of course, we should have this session, even though it's a little late at night. But wow, it's great to see so many people. So I have a PowerPoint, but I'm not going to use it so that it seems like this won't be too long and you won't get discouraged. So first I have to say nothing in this presentation is meant to be legal advice about your specific situation. So if you're a lawyer, that's what you have to say when you're speaking. So this is going to be general information, and it's about brand new rules that have not started yet. And so it's going to be our opinion, or the firm's opinion on how these rules will be applied. And most importantly, what I want to talk about is how we can try to mitigate the damage that we think the rules are going to bring to the CF community. So the rule changes are not good for people with CF. And so don't get discouraged. We're not trying to be pessimistic, we're trying to be realistic. So this is the first public presentation we're giving on the rules, and so I don't want to make it sound like doomsday, but I do think it's important for us as a community to understand that the changes are significant, and they will make it harder for many people to get benefits and for many people to keep benefits. And so I think it's very important for us to work together to inform people about what they can do to try to make sure that if they're applying for benefits, they have very good evidence as to why they can't work, or if they already have benefits, what should they be doing to make sure that their records reflect why they can't work, and what are some kind of tricks of the trade that can help people so that they are not reviewed by Social Security. So if you see, we have a little table out there. We run the CF Legal Information Hotline, and that is sponsored by the CF Foundation. We've run that since 1998, and we've had about 40,000 calls. So we've had a lot of calls from a lot of people. And we give information on Social Security, Medicaid, Medicare, health insurance, education, and employment. So you can call us for free, it's confidential, and we'll be here all day tomorrow and Sunday, so you can feel free also to stop by our table and ask us questions there. We also have the CF Social Security Project, which is also funded by the CF Foundation, and that allows us to represent people for free in a Social Security either application or something called a continuing disability review. And that's where you have benefits and Social Security decides they want to make sure you're still eligible for benefits. And right now, Social Security in the past year has done 400,000 reviews, but Congress has given them money to do 800,000 reviews. And so we are getting probably double, triple, quadruple the number of calls from people in the CF community that are being reviewed. And that's why, because Congress has said to Social Security, we think there are people who shouldn't be getting benefits, and we want you to root them out and kick them off. So in the past, people with CF were barely reviewed. And so this is a big change for people now to get paperwork that says we're reviewing your eligibility. So it's very important to sort of, if you're online, if you're on these social media sites and someone says that they have gotten review paperwork, suggest that they contact the CF hotline, because then we can help them with the review. The reviews are not easy and they're very tricky. And so once the person has done all the paperwork on their own, it's very hard for us to then try to be successful in their case. So we've handled almost 4,000 cases in 25 years, and we've won all of the cases we've handled. So, we have brought our entire staff, except for one attorney. We have Amy Sobchak. You want to stand up? She's our lead attorney who does all of our Social Security. And then we have Lacey McCaslin, Brenda Sanchez, and Malika Johnson. Stand up. They woke up very, very early to get here to try to save us money. And so we appreciate that. So they work on the cases, and that if you've called, you'll probably speak to them, and they'll be around as well. So for the CF Social Security Project, it's free, and you do not pay. You never pay us. And so that's very, I think, important for people. So on June 9th, that was the day of reckoning this year, when the Social Security published revised medical criteria for the evaluation of people with cystic fibrosis who receive benefits. So it's under 81 Federal Register 37138. So, and you can stop by our booth and we can give you the link if you want to read it. And the revised criteria will take effect on October 7th. Very important that if your case is pending on October 7th, you're going to be evaluated under the new rules. And that's not the way they used to do it when they issued new rules, but that's the way they're doing it for us. So there's probably not enough time if you're filing a case, unless we file it for you next week, that we could get a decision before October 7th. And we think that on October 7th, there's going to be lots of flashes of light all over the country. Lots of loud screams from our office in Houston. But we do think that the Social Security local, they're coming today. Okay, if I'm not here in the morning, you'll know that they found out where I was. And not everyone is bad at Social Security, just most people. Just most of them. There are a few good ones. They're very hard to find. So I think, people kind of get a misconception of, well, I have CF and I just have to tell them that and I'm going to get benefits. And that's really not the case. And I think we heard, such an emotional story earlier about a mother and her daughter. And I think that people at Social Security really don't respond to that kind of, to the kind of thing of CF is bad and here's all these people that are so sick. And I think we think that generally people respond to that. And people at Social Security don't really respond to that. And the other thing is that people with CF are young compared to other people applying. So 70% of people applying for disability are over the age of 55. And so anyone applying who's in their 20s or 30s is really, we say, red flagged. They're already suspicious because the person is so young. So that's important to know going into the whole idea of Social Security, and especially for reviews. When people are reviewed, I know there's a few people in here that are being reviewed, so I'll not look at them. I won't out them on the fact that they are being reviewed. But when you're being reviewed, Social Security is looking to see if you've had minimal medical improvement. And if your records show you've had minimal medical improvement, then Social Security is supposed to terminate your benefits. And so what that means is that you need to make sure that when you're going to your physician, to your CF center, that you are accurately telling them what problems you're having. Because we just did an exhaustive analysis of all of the cases we have right now, and we have 125 cases, and I'd say 56 have really bad records, where it says, Jane says she's doing great, running a triathlon, working out, instructing yoga, volunteering here, volunteering there, going to the moon, curing cancer. So if you have records that are talking about a lot of different things that you're doing, it is more likely that Social Security is going to think that you're not disabled. And that hopefully makes sense. So you want to make sure that your medical records reflect, what do you think would be the most important thing?
Treatment.
Treatment time. Thank you, GDA. So treatment time is key because most disease groups don't have the amount of treatment time that we have. And so very important to make sure your doctor is writing, or the nurse or the social worker, whoever's taking the notes, are typing them into the computer. How much time is it taking you to do treatments? So a lot of times we see records that it says doing 2 treatments a day. But we see that they're on like 8 different inhaled medicines. So 2 sets of treatments is not what you want to have reflected in your records. You want every specific treatment. So if you're doing albuterol, pulmozyme, Toby, hypertonic saline, that's 4 treatments plus airway clearance is 5. So if you're doing that twice a day, that's 10. So who thinks 4 is better than 10? So you just think about like dollars, like $4, not as good as 10. Same thing with treatment time. So the more treatments, the better. So what does that mean if you're on a puffer of albuterol? You're just puffing it and it takes like 2 seconds. Better to be on?
Nebulizer.
Right. So nebulized better than a puffer. So Toby Podhaler, not to give brand names, but whatever, takes about a second, but Toby takes about 45 minutes if you include cleaning. And so if you're, what?
Does Social Security know how long it takes?
What do you think?
No.
No. So how would they find it out?
I don't know.
It would be in your records. And it would be in your
how
medical.
long it takes to do
Well, it should. It should. It should. Well, Podhaler's not going to help you, so I'm sorry. I mean, if you like Podhaler, great, but if you're trying to keep Social Security, Podhaler doesn't help you. It's very quick. It's very, very quick. You can work and be on the Podhaler. So if you're not working and you're trying to explain to Social Security why you're not working and it's because of treatment time, you got to have treatment time. So you can do whatever treatments you want. Obviously, I'm not a doctor. I only play one on TV. Not really. I'm not on TV. Or I'm like sort of on TV now. But you have to think about these things if you're trying to keep your benefits. You want to make sure that you are doing what you can to make a good case before Social Security. So the new rule, maybe we should just quickly say the old rules, and then you can see how dramatic the new rules are. So the current rules are You can qualify for benefits if your FEV1 is below 50% for the year prior to applying or the year prior to the review. And that's regardless of your age, your sex, where you live, anything. It's everybody across the board. It's about 50% or below. And if you have that for the past year, you can qualify. So we have about 30% of people with CF qualify based on FEV1. The next way is 3 hospitalizations or 6 physician interventions. So we love the 6 physician interventions because it's sort of like if you're at the airport and you see that Panda Express and you can get like 3 different things. You can get a combination plate, you can put in noodles, egg rolls, soup, orange chicken, so you can kind of mix them up. Same thing with 6 physician interventions. You can do 1 hospital stay, 1 home IV, 2 hemoptysis, then you're hungry for dessert, you can throw in 2 clinic visits for an exacerbation. So that's the way a lot of people get benefits because you just pick and choose from a bunch of different things. So that section is going away. No way. And so let's just backtrack. So on FEV1, FEV1 is now this extremely complicated chart based on age, gender, gender and age is very complicated. So we think, again, no one here is working for Social Security, right? Okay.
Right.
If there's like a spy, they should probably leave. We're not going to know if they're a spy, but anybody looks suspicious. Okay, so we don't think people at Social Security are going to understand these new FEV1 charts because we're looking at them and we do this all the time and we don't really understand them. And the other thing is that if you're 6 to 13, there's one criteria. 13 to 18, there's another criteria. And 18 to 21, there's another criteria. So if you're 20 when you start the process, you're going to go under one criteria. And then if you turn 21 while your application is still pending, you're going to go under another criteria. We don't know then which criteria we're supposed to use. So we think that the FEV1 is going to really slow down the assessments and be confusing. So that's FEV1, physician interventions is being taken away. The only thing that stays the same is 3 hospital stays. Has to be for a pulmonary exacerbation. So if you're in for a lot of stomach trouble, it's not going to count. So right now we have 2 home IVs. They could be a minute, they could be an hour, they could be 10 days, 90 days, 100 days, doesn't matter how long they are. Just once every 6 months, home IVs. Right now, that's the criteria. And then the other thing that we like is inhaled antibiotic, which is Toby, Caistin, Colistin, anything else off-label, plus a lot of treatment time. So 80% of our clients right now would meet that criteria. And that criteria is going away. So this is why I say it's not good. Somebody the other day said, I don't know why you say it's not good. And I was like, okay, well, do you have a few minutes? So that's really not good. So what did they put in? They put in being on a ventilator for more than 24 hours. They put in having a pneumothorax, requiring hospitalization, which I don't know, Paul Quinton, if you could, if all the doctors could comment on, if you have a pneumothorax, I think you will be hospitalized. We don't have hardly anyone having pneumothorax anymore, which is good because people are doing well. But as having that as a criteria for benefits is, we don't think, very good. And then hemoptysis, but requiring embolization. Yeah. I know, I'm sorry, this is depressing. Okay, it's gonna get a little better with my magical powers of trying to fix this. So hemoptysis right now is a really important way for people to get benefits because even if you don't need embolization, if you're having a lot of episodes of hemoptysis in a month, it's very hard to work. So that's, we think, going to be problematic. So the last change is a wacko thing that they've done. And my staff is laughing at the word wacko, but two of them are almost asleep, so. That's okay, they woke up early. Okay, so at the end, what they did was they made this little chart and they said, sort of like a combination plate. If you have two of these things, then you can qualify. So CFRD is one of them, and G-tube is another one, and home IV of 10 days or more is another one. And the last one is embolization for hemoptysis, again, because they seem to like that one. So then you have to have two of those. The problem with so you think, well, that's good, CFRD, that's good, lots of people have CFRD. But when we look at how they apply the diabetes criteria in other disease groups, we see that you really have to show not just that you have the CFRD, not just that you have diabetes, but that you also have it, it's uncontrolled. So it doesn't say that, but basically what we are saying is we know it doesn't say that, but we know how Social Security applies the diabetes criteria, so we think that's how they're going to apply it. If you have controlled diabetes, it's probably going to be hard for them to say they're going to approve your application.
Can you please repeat that list of the two items?
The two items is home IVs, but they have to be 10 days, and they have, if you're going to go for two home IVs on your combination plate, they have to be 30 days apart. And then CFRD, but we think it's going to have to be uncontrolled, and then hemoptysis requiring embolization or G-tube. Okay. So, what we want to try to do is try to get guidance from Social Security that says that if someone is medically equivalent to these criteria, they can get benefits. And in the Federal Register where they list these criteria, it says, of course we will consider medical equivalence. The only problem is in 25 years, we haven't ever had a case decided at the initial application based on medical equivalence. They usually say you have to wait to go before a judge to get a decision on medical equivalence, and that takes 2 years. So we're hoping to get more, the CF Foundation, CFRI, Boomer-Esiason, different groups to sort of band together to convince Social Security to issue guidance that is to the local offices that says you can decide medical equivalence on the initial application. Because we think that's really the only way to try to get cases after October 7th decided in a quick manner. So it seems like a large ask, but we think that we have to do something. And you know me, I don't give up, and I know most of you, or all of you, don't give up either. And so we're hoping that that's going to be the way we're going to work around these rules that seem very severe. And certainly if you're in end-stage CF, you're going to meet one of these criteria. But what we have spent the past 25 years doing is advocating for people to stop work before they're in end stage. And we have people at this conference who have done that, who even just a few hours ago told me how helpful that has been for them. You know, and we have a lot of clients, I think, whose lives were saved by stopping work before they were at end stage. And that's why when we read the rules initially, we were quite upset because we still want there to be a pathway for people who really want to stop work because they want to spend more time taking care of themselves and maintaining their health. We feel like it's very important for there to be a pathway for benefits for those people, especially now when we know there's a lot of new drugs on the horizon. There are a lot of physicians who tell their patients, we really think you should stop work now, try to get your function up and stabilize your health so that you can benefit from these new drugs. So That doesn't mean you have to stop work if you don't want to stop work. So usually after I speak, somebody sends me a mean email saying, you shouldn't tell people not to work. So obviously I am working, I have CF, I'm 50, I'm not telling people not to work. But what I'm saying is if you find, what we say to people on the phone when they call us is, if you find that it's hard to work and take care of yourself, and you keep getting sick, that's a message to you that maybe you should stop work. You don't have to stop work forever. And also you can volunteer. You can actually work part-time, making up to $11.90 a month from part-time work and get benefits. So for a lot of our clients who are working at low-wage jobs, they can actually make more money working part-time and getting benefits and having time to take care of themselves than if they're working 40 hours at a grocery store doing stocking, which sometimes is very hard for people to do. So hopefully you'll hear in a few months that Social Security is going to issue this new guidance if we're successful. But in the meantime, I think it's very important for everybody to spread the word. Medical records are very important. And we have file cabinets full of files of people who call us and say, oh, I'm not stopping work for 2 years, so I'll call you back in 2 years. And 2 months later, 3 months later, they call and say, I have to stop work. I've had a major bleed or a major exacerbation, and I need to stop work. So you never know when you're going to stop work, and that's why it's good to just always make sure that your medical records are accurately reflecting treatment time. The other thing that's important is coughing in the middle of the night, having to take naps, having to sleep late because you've been up, if your diabetes is uncontrolled, if you're having hemoptysis, if you have very bad sinus headaches, all these things should be in your medical records. Things that should not be in your medical records. I went hiking in Vietnam. And then I went to Cambodia, and I hiked there too. So trips, I don't want trips. I like trips. I personally love trips, and I think everyone should go on trips, but I don't want them in the medical records. Okay, no trips, and really the Ironman, the triathlons, the marathons, I don't want those in there either. Right. And it doesn't really have to be in there. Exercising, fine, but that you completed the Ironman, it's not good if you eventually have to have benefits. If you are on benefits, what is the big thing that will trigger a review for you? Anybody know? Working. Wasn't there a song like Working with like the Village People? No? I don't know, maybe not. Somebody had a song about working. Okay, so if you really don't think you can survive without your disability, and you don't want to be reviewed because you've had a lot of medical improvement, you should consider working under $800 a month, because under $800 a month won't trigger a review usually. Over $800 a month, between $800 and $1190 could trigger a review. So if you are working, all the more reason to make sure that your medical records are very good. And I think that's really the key for everybody, is to have good records and also to understand the rules. So the rules about working are very complicated and sometimes very confusing. So you can stop by tomorrow and ask us about those rules, or you can call us, you can email us. But if you are going to work and you are on benefits, call us to make sure you understand what the rules are, because every week we get like 10 to 20 calls and people say, my benefits have been terminated. Supposedly there's an income limit on how much I can make from working. And we're like, yes, of course there is. So that's very important. And for those of you who are online on these chat I don't know what they're called now. Social media, is that what it's called? I'm showing my age. See, this is an old picture. I didn't even give them this picture. They just used this out of the goodness of their heart, because this is when I was really young. So you can sort of be like an ambassador. We don't want you telling people the law, because that's against the law. We don't want you like posing as an attorney. Please don't do that. But if you have, you see people posting things, and then usually what happens is someone posts, how much can I make? And someone posts, as much as you want. Maybe chime in and say, you might want to check with the CF Legal Information Hotline, so that people get the correct information. Getting incorrect information is what really causes people a lot of trouble. So you've been very kind, and there's lots of wine sponsored by CFRI. I suggest that you drink it. Oh, now I see I'm taped. This is bad. It's bad. Really bad. My law partner cannot see this tape. Okay. Yes.
Can you address patients that have had, I'm sorry, people with CF who have had transplants?
Yes,
And
okay.
are maybe in that age range where they're trying to go to college and they can't work?
Well, the only thing I tried to say, which, oh my God, I didn't say it, is the only thing that's good about the change is that they are having a presumptive disability 3 years post-transplant if you're not working full-time. So that's good. That's very helpful. But even after that, you can still stay on benefits post-transplant. So we've gotten a lot of calls of people saying, I guess at 3 years they're going to kick me off. No, they're not going to kick you off if you can show that you can't work because you've had the transplant. That would be because you're immunosuppressed, you have to go to the doctor a lot, you're sleeping, a lot of people have GI trouble. So you can make a very good case post-transplant, no matter how many years. We have people 15, 16 years post-transplant that we've helped with reviews that stay on benefits. But again, you need good records, and some of the transplant centers are not very good about keeping good records either. So you want to make sure that the records post-transplant are good. So your question was about when you're...
Okay, so it's going to college.
What?
Going to college and going on benefits?
Patients that are at that age range where they want to, now they're healthy enough to go to college and they don't want to work while they're doing that, and they want to be supported by Social Security. And they've had a transplant.
Great. I think as long as they can show that they can't work full-time, I think that's fine. I think that's fine. I think we should not be against benefits for people. And there are a few clinics that they will not support patients on getting benefits. They think everybody should work, I guess, until they drop dead. And we don't think that's, we think that if you want to live and that you think that means not working, or you want to go to college and you can't both go to college and work and maintain your health, that's why there are benefits. Yes?
Are some of the confusion going on in the healthcare community because they're moving from ICD-9 to ICD-10s, has that changed a lot of the benefits going forward?
I don't think so.
Okay, so the criteria is pretty much the same going from ICD-9 to ICD-10?
Yeah, I don't think that was it. It's really a lot of pressure from Congress, a lot of negative media saying there's all these scammers on Social Security, and so there's this idea that they've got to root out all the scammers. We never see any CF scammers. We have the same calls every day. I'm different than most people with CF. I'm very driven, and I've always worked. This is like, I can hear this 20 or 30 times like every day. Everybody says the exact same thing. But my doctor says I should probably consider stopping work. And I always say, I just want you to know, everyone I've ever talked to with CF is driven, and everybody wants to work. So, that it's everybody wants to work. Everybody with CF is driven. But it's okay. You can still be a good person with CF if you're not working. I mean, we don't have to say to people, you're not successful if you are not working. I think we should say, you should make the best choice for yourself. And if that choice means not working because you can take better care of yourself, I think we should applaud everyone. I always tell people, you're the strongest if you make the best choice for your health, which is very hard in our society to not work or to not work a lot. It's very hard. It's a very hard choice. But I frankly think those are the most successful people. The people who really realize the importance of taking care of themselves and stop work before it's too late. And we have 2 very good studies that show if you stop working and go on benefits between 40 and 50 FEV1, your FEV1 within the next year goes up 10 to 18%. That's of our clients in 2012 and 2013. But if your FEV1 is below 30, we see almost no change or decline in FEV1 because people are too sick. So, I mean, there is very good actual data that shows that at a certain point, it is a good idea either to lessen your workload or to stop work for a period of time.
You just mentioned that you lessen the workload. Can you still be eligible to go on Social Security and say, okay, I can only do part-time?
Right. So making less than 1,190, and we don't like more than 15 hours. So Monday, Wednesday, Friday, 5 hours.
Yeah.
We like a break day in between. So yes, you can still do that. Yes.
Hi, Beth. I just wanted to share our experience. I have a 26-year-old daughter, and we applied for Social Security for her, and they kept denying. We finally hired some lawyers, and we went in front of a judge. And it was really interesting because they had a labor department person there. And basically what the judge was trying to figure out, if you have CF and you get sick and you cannot go into work, or you have a really bad night and you cannot get up at 6 o'clock in the morning because you need your sleep,
Right.
would there any employer keep you on the job, or they would fire you, let you go, not knowing maybe that
Right.
you have CF,
Yeah.
And basically, private sector, obviously, yeah, you're not going to be kept on the job. And what was interesting, you cannot even keep a government job because the government even won't put up with you if you are absent more than 30 days. So based on that, that's how she got the Social Security.
Right, but that you have to go before a judge.
Yeah.
So we have about 10 cases that go before a judge a year because we want people to get benefits earlier than waiting 2 years. So, we really want to focus on how can we get benefits for people early, especially a lot of the people, I think the CFRI community is just made up of these amazing parents that would walk through fire for their children. But I think we don't forget in our office, but I think people don't realize that there are quite a lot of people with CF who don't have family to help support them. And so their only way to support themselves is through benefits, and they can't wait 2 years. And that's why, we really feel like this project, the funding that we get for the CF Social Security project is just a blessing for those people, because those people must have the benefits in order to support themselves. So you guys have been extremely kind and generous, and don't be discouraged. We will do it. We have done a lot of things that people said could not be done. And so we will forge forward, and we look forward to talking to you in the next 2 days, and I really appreciate you listening. Thank you.